So magstorya na dito sa hips, kay hips don't lie. And then, yes. So we'll talk about this type of view first. There. And then, ang kaning naa sa pinaka-kuan, naa sa pinaka-top here na mo form siya letter C. C. This is what you call the iliac crest. This is the iliac crest ng kanisiya. Next, ang kaning na ay kuan din sa kilid, kanisiya, na naiana din this is sa kilid here, right here. This is what you call the sacroiliac joint. Kaning nasa kilid. This is the iliac crest, this is the sacroiliac joint. Next is ang kaning padong din sa ubos. Na padong ubos here. This is what you call the pelvic brim. This is the pelvic brim. Ang kaning murag na ay kaning gamay na dent here. Di kayo siya makakuan din sa kuan, pero na siya gamay na dent. You should be able to see a gamay na dent here. This is what you call the ischial spine. And then ang kaning naa dinhi sa kuan, kaning naa dinhi dapita sa pinaka endmost. This is what you call the acetabulum. This is the acetabulum. So balik na, pelvic brim, the ischial spine, and then this is the acetabulum. Next is ang kaning naa din sa end, this part here sa pinakatumoy. This is what you call the makon siya sa pubic arch, pero yeah, pubic symphysis. Naan siya kanang something sa tunga here. Nandito na po sa left side here. So yes. So kani siya, part ni siya sa coxal bone or hip bone. Kaniya, ang kaning flat here na surface, this is what you call the ilium. Next, ang kaning padung sa ubos. Ang padung sa ubos, like here, this is what you call the pubis. This is the pubis here. And then, ang galing natin sa ubos, na pinaka-lower or inferior, this is what you call the ischium. So, once again, this is the ilium, this is the pubis, and then this is the ischium. So, mauna siya sa anterior. And then, all parts here sa flat surface, basta gani ang point of view sa posterior view. All flat surface here is ang atong Ginoo, which is the ala. And yun, dayon, ang kaning naa din is here na part. This part here, this is what you call the iliac crest. And then, ang kaning murag kuan din sa tumoy-tumoy, this is what you call the anterior superior iliac spine. Naog na to here, sa kaning ikadulang murag sa C, this is what you call the anterior inferior iliac spine. Next, kay kaning nasa tunga, this is what you call the acetabulum. And then, after ani, is this one, this part here, this is what you call the body of the pubis. Then, ang kanina part is pubis. And then, kaning sa ubos na gani, kaya naman siya sa ubos, so inferior pubis ramus. And then, this one here, ang kanina, this is what you call the obturator foramen. Obturator foramen. And then, ang kanina part here, this is what you call the ischial ramus. This one right here is the ischium. Yeah. And then, kanina na part kay ni-round naman siya. Kay, this is what you call the ischial tuberosity. Next, kay inigsaka na to gamay here. This should be our ischial spine. And then, right here is our ischial body. Kani siya dapita, kaning murag ni kuan din ni dapita. This is our greater sciatic notch. Anyways, and then this is the posterior inferior iliac spine, and ang kaning nasa taas, this is the posterior superior iliac spine. This is what you call the humerus. Dun dun dun. Ang kaning kuan here, the smaller part na circle. This is what you call the greater tubercle. Since siya man si greater tubercle here, ang kaning nasa tunga, this is what you call the lesser tubercle. Okay? And then, ang kaning the part here sa taas, this is what you call the head of humerus. Yeah? And then, ang kaning naadin ni dapita, like this part right here, specifically right here, this is what you call the anatomical neck. And then, when you go down, like as you can see, more na siya more badlis here. This is what you call the intertubercular sulcus. Yeah. Next, ang kaning mga body here, this is what you call the deltoid tuberosity. Okay? The first circle na makita here, dili kayo maglaro. Kaning naay murag kuan here. This is what you call the radial fossa. And then next, ang kaning naa din sa tunga, circle, this is what you call the coronoid fossa. This is what you call the capitulum. This circle right here, rather. This circle right here. This is what you call the capitulum. Well, this one is what you call the trochlea. Igani na angle. This one is what you call the surgical neck. If kani ang gibasi. Next, if makabantay ka sa kaning murag kuan here, na kanang igana na line, this is what you call the radial groove. Then makakita gyapon ka sa tuberosity sa deltoid because again round. The radial groove niya ang kaning naan din niya. Murag kuan siya na line. This one's the medial epicondyle. Kaning mga down parts here, this is what you call the trochlea. Masita sa siya sa ani na group. Yeah. Trochlea ni. And then ang kaning part na naay kuan here, that is one. This part here, this is what you call the lateral epicondyle. A medial epicondyle was right here. And then this one's the lateral. And yeah, this is the olecranon fossa. That's about it for the humerus. Hello guys, so nanata sa the lower part of the arm. Yeah, and then if you need a hand, I have a hand. Okay, let's start. Ang kanisiya na part is right here. This is what you call the ulna. May lan siya kay more na yung form of somewhat an L. This part right here, this is what you call the trochlear notch. This is the trochlear notch. And then, ang kaning naa din ni dapita sa kuan, like right here, sa tunga-tunga. This is trochlear notch, huh? And then this na sa tunga-tunga, this is what you call the olecranon. And then, right here, sa kaning na sa kuan, sa tunga, sa below sa olecranon, this is what you call the coronoid process. Next is kanang sa ubos ani niya. Yeah, sa ubos ani niya. This is what you call the ulnar styloid process. Yes. Now, kung imo niya siya sampayon, imo niya siya sampayon like this. Ang kaning naa din ni dapita sa ilang sumpay, this is what you call the proximal radioulnar. This is what you call the proximal radioulnar joint. You know, interosseous membrane. And then this one, kung magsumpay siya din this is what you call the distal radioulnar joint.
Kay pagawas naman sa lawas. Well, this one kay padung.
So yeah. Next, we're gonna talk about the radius. As you can see, ang radius kay owning the mic. And then ang radius na part, this one is called the head. This one's the neck. This one's the neck. Next, ang kaning murag na ay dent here na round. This is what you call the radial tuberosity. Niya dayon sa pinakaubos, this is what you call the radial styloid process. So, yes, guys. So, ma-explain ko saan. Ito lang iyan na. Anyways, ana din a view. Alright guys, so ang starta here, this is what you call also phalanges. Naam to sa feet. And then Oliva talked about like itong mga three parts na ana sa phalanges. This one's the distal, kay mao ni padong gawa sa body. This one's the middle, while this one's the proximal. So the phalanges, there are the fingers here. Kaning mga gamay na parts din ni dapita here. This is what you call the metacarpals. Nasa ubos sa tiil, that was the metatarsals. This one's the metacarpals or the palm. So, ang nasa one na metacarpal, this is what you call the trapezium. And then, ang padung dito sa left, this is what you call the trapezoid. This one is called the trapezium. This one's the trapezoid. Ang ikaduha. Ang ikatulo di ay, this is the capitate. While ang ubos ani nila, like right here, this is what you call the scapoid. So, ang kaning nasa 5 parts na. So, ang kaning pinakakuan din na part, like here, this part here, right here. This part right here. Kani. kanina part here, this is what you call the hamate. And then this one, getting circle, na weird kay forma, this is what you call the pisiform, ang P. And then this part right here, ang kanina gamay din here, this is what you call the triquetrum. And then ang tunga na dinidapita, this is what you call the lunate. And then ang kanidapita dayon mo connect dayon ang katong ulna, this one, and then this is also the radius. And that's it if you need a hand.